is a UCU member, and it's Martin Johnson. And just ask if you can speak as loudly as, not because she's Scottish, but
yeah, I was going to
it's
say,
just
it's loud enough.
hard to
And that's from the Clyde, where a lot of this was built originally. And, you know, without being nationalist here, it is important to note the NHS in Scotland is a very different beast. Let that be a lesson. Let that make it very clear the decisions and the attacks we are facing down here are political and they are ideological. And there are choices and there are alternatives. Sorry, that was a bit I wasn't expecting to come in that way, but it's an important point. Yes, I'm an academic, but yes, I'm a citizen, and yes, I give a toss. And that's more important, and that's why I'm here this evening. And I want to thank all of you for coming out, and I want to thank the Trades Council for the opportunity to speak. So, let me think. We've had a lot already this evening. Here's a question for you. Maybe all these problems are just a little glitch. What's wrong with privatising healthcare?
You want to answer?
You want us to jump we can get embarrassed. I'm not saying this best answer. What's wrong with privatising healthcare is profit. Let's not forget the privateers behind the big healthcare providers are businesses. They are an industry. That is what they exist for, to generate profit. They exist to extract. And that occurs at every level of industry and business. I had hoped we would have some audio-visual stuff, but we don't, because I had that nice picture which I hope a lot of you have actually already seen, where you see the phrase, are you feeling anxious, depressed, fearful of the future? Yeah, you're suffering from capitalism. And that's what it comes down to. This is a great thing about not being aligned to anybody or party and speaking exactly as I want as an individual. We've heard about health inequalities. What causes inequalities? Capitalism. It divides, it creates the barriers, it condemns large sections of communities and population to all manner of different levels of life expectancy. In the UK just now we can see anything up to 20-year gaps depending on levels of deprivation, depending on the terms of realistic hope, proper education, employment prospects. And by employment prospects I mean real employment prospects. I don't mean, right, you've got a temp agency there or you've got a 0 hours contract, and is there any kind of mystery that actually the health and social care sector is one of the biggest sectors where around in a recent Office of National Statistics survey reported around 25% of the workforce are now working under those kinds of conditions. Not knowing whether they have work tomorrow, not knowing what they're going to earn at the end of the week, not knowing what they're going to earn at the end of the month. How do you plan a future? And indeed, more importantly, how do you provide a decent level of care? So, to me, that's the problem with private healthcare. It exists to generate profit. And when we look at this, and when we look at a couple of examples of two of the big providers, last year, both Serco and Virgin Care were both subject to the Care Quality Commission investigations and put into particular special measures because of serious concerns about the standard of their care. Serco in particular, have to give them their due, they had their own internal investigation which actually found that some of their employees were falsifying records. Why were they falsifying records? To make it look as if the productivity was better to the next level up. Why is that important? Because in order to secure the contract, to maintain the contract. These are some of the serious hazards that actually inhabit this whole sector. Virgin Care Limited. Anyone like Richard Branson? Get your Wi-Fi from them, your TV from them? Yeah, nice down. Anyway, their accounts for financial year 2012-13. Let me just give you a couple of interesting features of this. Their staff costs. Now, it's important at this stage, in this particular financial year, Virgin Care Limited, this is not doctors, this is not nurses, this is not health professionals, right? They employ staff because largely it's a management consultancy firm that supports the subsidiaries of other branches of Virgin Care which operate regionally, some of which, as I referred about tonight, will be bidding for precisely that type of contract. So, the economy last year paid wages and salaries with around 120 employees, £7,038,887. I think I should change jobs. Let's also look at what they paid their directors. They had 2 directors. Between them, 2012 to 2013, £585,618. Now, Virgin Care Limited exists on the basis of NHS contracts. Some of our colleagues this evening have spoken about some of the ludicrous amounts of pay for those that are still technically in the NHS. You know, if you're looking at trousering about £250,000 to be a director of a company, that's money that is not going to care. But any of you sort of face these kind of performance-related pay things? Because this might give you some heart. Because in fact, you want to know how Virgin Care Limited did in that financial year? They reported an operating loss of £10,933,837. I knew if that cost my gaffer that amount of money, I would not be getting paid £250,000. Why does that happen? How can they possibly be losing all this money and still be an ongoing business? Well, I already mentioned to you, one of the interesting things about Virgin Care is that actually it's an overarching company that controls, I think it's something in the order of about 25 subsidiaries at the moment. But it doesn't stop there. Let me give you a look back at the bottom of their financial statements. The company is a subsidiary of Virgin Group Holdings Limited, a company incorporated in the British Virgin Islands. I'm presuming you've all got an interest in a lot of things that are going on. Have you seen that sort of thing before? Boots, Vodafone, Amazon. They put the parent company in a tax haven, and do you want to know what the Care Limited's tax bill was for that last year? 0. To me, that's the real scandal. That's the real shock here. And whilst, I mean, this is one of the biggest problems with groups like Virgin Care Limited, is they are actually moving into the sort of clinical care delivery. But I could go on, and in the follow-up, I hope we will be able to disseminate loads of this stuff for you. Because actually, enormous amounts of money that are coming from central government, that are coming from the NHS budget, are being paid to companies like this who own it to themselves, who charge themselves ridiculous amount of management and consultancy fees, and what it does is it takes the money out of the whole front line, patient care, staff salaries, and everything else. And of course, this element of the private involvement is not new. The biggest, well, one of the biggest expenses that the NHS faces is the annual drug bill, the pharmaceutical industry. It runs currently at something of the order of 9 billion a year. It approaches about 10% of the total budget. You ever looked at pharmaceutical companies' accounts? You ever seen their profit margins? The whole point here, which really annoys me when I think more about this, is we have one sector of industry, because let's face it, these groups would not be interested in healthcare if they didn't think they could make money out of it. So the idea that it's not sustainable or can't be delivered is frankly bullshit. What they want to do is squeeze it and recognise it, because let's face it, we've had a recession that's been going on for quite a few years. We've got a real-term drop right across the sector in terms of earnings. They can't sell this shit anymore. We can't afford the new tellies. We can't afford the new cars. Most people prioritise the new and latest phone. Yeah, they're running out of things to sell us. Health, education, social services, we need them. You can't not have them. You can't not buy them. And for these companies, the key point is there's next to no risk. The National Audit Office undertook a big inquiry of some of the big four, G4S, Atos, Serco, and the other ones just momentarily escaped my mind. These companies who get contracts are not even required to disclose the profits they make. How can they be accountable? How can we call them to task in terms of what we do? Personally, whilst I hope we will see great strides and a major change in the next general election, frankly, I can't wait for that. There are things we can do now, there are things we have to do now. Irrespective of the party politicians, not a nice little list of parliamentarians, those in the House of Lords, MPs in the House of Commons who have like these vested interests in these services. That's cross-party. In fact, when the Health and Social Care Act of 2012 was passed, it's interesting within the council chamber, had any of our local councillors had those kind of connections, they would have been barred from voting on such an act of parliament. That's the kind of level. This isn't, I don't know if they see it as corruption. They think it is the way it is. They think there is nothing wrong with this. And let's also remember, the coalition polled something of the order of 38% of the total vote. I found that amusing because last week the likes of Galvin Ellis were saying things like, unions don't have a mandate to do this. But not only do they have next to no support, none of this shit was in any of the manifestos. It's snatched out of the air last minute. I'm not much of a conspiracy theorist, but nonetheless, I could be persuaded otherwise. So, as well as supporting the demonstrations, as well as supporting the campaigns, as well as, I think we have to sort of move to a level where we start taking action locally. And this might sound a little bit ironic. One of the ways this has been sold is it's about choice. It's about community involvement. So what I say is, let's bring it on. Let's get involved in the trusts. Let's get involved with the clinical commissioning groups. Let's get involved with Health Watch. And stage one of that is let's get ourselves informed. What's of this stuff? It's not difficult to find. Are they looking for people? You know, give us an hour a week. Come on. Even Richard Branson's telly's crap. We might need his internet because you have to go online to get this stuff. Let's get informed. Let's share this and let's start thinking. Actually, in a whole manner of very different and very creative ways about health. Prevention is better than cure. I agree with you. We're in a stage where actually we need cure. And again, ask yourself, why do we need cure? They sell us shit that kills us. The pharmaceutical industry, biggest drugs, statins, antidepressants, type 2 diabetes medication, lifestyle factors. what do we get to eat? So you get one section of the industry makes you ill, you get the other section of the industry that says, don't worry, we've got pills that will make you better, all in all, at all costs. So I hope that after tonight we start to build something, and as I say, in addition to everything else, and all the party politics and all the rest of it, trust me, there's a great deal we can do walk away. I'm going to leave you with a little quote that is often my one in such things. It goes like this: often we need to change our concepts, not only the general concepts, the social or philosophical ones, but also sometimes our medical concepts. From one Dr. Ernesto Che Guevara. Thank you.